Good afternoon, ladies and gentlemen of the media, and good afternoon to our listening and watching audience here in Bermuda and around the world. This evening, I will give a COVID-19 health update. I'll provide information about the new mental health line that is now available, and I'll also discuss free online training opportunities that exist for Bermudians. Today, I am joined by the Minister of National Security, who will review items regarding our shelter in place. I am also joined by the Attorney General, who will review items regarding the shelter, which has been set up for vulnerable persons, and also the Minister of Tourism and Transport, who will give an update related to transportation matters and the Transport Control Department. I'm also joined by the Minister of Health, who will be here to answer any questions related on health matters. Today, the government of Bermuda received 49 new test results as a result of our aggressive COVID testing regime. Out of the 49 tests that were received, 40 were negative and an additional 9 were positive. However, it is also my sad duty to today report another COVID-19 related death. Today's tragedy is among the new 9 positive cases that were reported. On this occasion, a middle-aged person whose source of transmission is still under investigation. I send my condolences to the family whose privacy we will respect at this tragic time. Bermuda's total confirmed positive cases stands at 48. 25 have now recovered, 10 are hospitalized, and there are 9 cases that are under active public health monitoring, but who do not require hospitalization. Out of the 10 who are hospitalized, 8 of those persons are in stable condition, and 2 of those persons are in intensive care. The range of ages for those persons hospitalized range between 58 years old and 75 years old, and the average age is 68. The average age of all of our confirmed positive cases is 49, and the median age is 48. And the age range of all of our positive cases is from 18 to 83 years old. Out of the 48 positive cases that have been confirmed to date, 27 are males and 21 are females. A review of our overall testing numbers show that to date, out of the 362 tests which have been conducted, 48 were positive and 306 were negative. It is on the somber note of yet another death that is related to COVID-19 in Bermuda that I have to remind all persons that the shelter-in-place order is there for a reason. We must take collective action to stop the spread of this virus, which has already taken 4 persons from us. We each have to do what we can to keep our island safe, and you do this by following the rules and remaining on your property. Tomorrow is Good Friday, and normally we would be out enjoying our friends and family while eating hot cross buns and fish cakes. You can still do that, but you must do it at home. No, you cannot go to your cousin's house, your siblings, or your friend's house to collect your usual order. This year, we have to sacrifice for the greater good and stay at home, recognizing that this is just for a time and we will get through it. But if we do not follow these directions, more persons will unfortunately succumb to this illness. As I've indicated before, once the shelter-in-place order is lifted, we will be able to enjoy our traditional festivities, of which we will observe at another date in our calendar. But I say to all persons that it is not the Premier of the country, the ministers of the cabinet, or even the elected officials that can make the difference in this situation. It is everyone working collectively together. Stay at home, only leave your house for essentials, and make sure that you are observing social distancing guidelines. These outings are not social opportunities, and I strongly advise persons to go and get what you need and then return home. We're asking that individuals only go by themselves. And we've seen that that is not being observed. And we're asking people to be mindful, as any additional resources that are strained with our police and regiment make us collectively less safe. On that note, I want to address a concern that has been expressed by people with pools and the possibilities of mosquitoes breeding. The Ministry of Health has confirmed that that is not an issue. Therefore, pool cleaning is not and will not be deemed an essential service during this COVID-19 shelter-in-place period. Pool cleaning companies should give instructions to their clients on how to perform self-maintenance. Pool owners can take guidance on a case-by-case basis from their pool cleaning company. But this request suggests to me that some people do not understand that cleaning a pool is not more important than saving a person's life. We must take this seriously and consider the questions that we're asking and the jobs that are being asked for regarding exemptions. So let me be clear. Cleaning a pool is not an essential or critical service while we fight to save lives. Also, as a reminder, if you are going out, you should wear a mask. And it is important to remember that masks by themselves will not protect you from contracting the coronavirus. But what a mask will do is prevent you from spreading the virus to others if you are an asymptomatic spreader of the virus. During earlier meeting today of the Cabinet, the Minister of Health did advise that she'll be issuing new guidance to all essential service workers that are out doing and conducting essential services that they must wear a mask in public. And persons who are not abiding by those particular rules, those businesses will not be allowed to provide any essential services. It is important to remember that the general public should not use surgical or N95 masks if possible. There are a global shortage of these masks, and they are best reserved for healthcare settings. However, please, if you're outside, cover your face, and there are instructions at coronavirus.gov.bm on how to make your own face covering. As we all learn to navigate a world we didn't anticipate, and the things we have taken for granted are no longer immediately accessible, our levels of stress and anxiety, coupled with uncertainty, has left many of us in need of additional support. We know that this pandemic has brought many new experiences and complications to many, and I share those concerns of the toll of which this is taking on so many of our families. And this is not what the government of Bermuda wanted to do at this time, but it is unfortunately necessary in our drive to save lives. If you need someone to talk to, a new hotline has been created. By dialing 543-1111, you will have access to a qualified, experienced mental health practitioner to talk to if you're feeling anxious, sad, overwhelmed, or stressed. This line will be open starting tomorrow from 9 a.m. to 9 p.m., 7 days per week. This hotline is available in addition to our existing COVID-19 hotline, where you can continue to get advice to your questions and general concerns. The difference is that this new hotline is about helping support our community's emotional well-being as we negotiate the day-to-day challenges of managing this pandemic. The government is grateful for the support of the Third Sector Crisis Response Effort for coordinating the work and the Bermuda Psychological Association for stepping forward to manage this new hotline. We are also thankful for the contributions of the Bermuda Hospitals Board's Psychiatry Department and Operations Team, the Mid-Atlantic Wellness Psychology Division, Bermuda Government Public Officers, and the Bermuda Health Council for making this a reality. I extend my sincere thanks in advance to the many health professionals who are helping to staff the Emotional Wellbeing Hotline. Again, the new Emotional Wellbeing Hotline number will open tomorrow, and it'll be open 7 days a week from 9 a.m. to 9 p.m., and you can call 543-1111. If you need it, please use it. For other general queries, you are welcome to call the traditional hotline at 444-2498. A final thank you to Dr. Allison Daniels, president of the Bermuda Psychology Association, who has done a tremendous job of helping to get this line up and running. With the support of the BPA, the Bermuda Psychology Association, we will also be managing the roster of mental health practitioners who will be answering the phones. I am pleased to report that yesterday, 20 Bermudians who were on the ship the Coral Princess returned home safely on 2 privately chartered jets. Once the travelers were processed, they were immediately taken to the government quarantine facility where they will stay for 2 weeks. This was a very difficult task to get these persons back here, and according to the Centers for Disease Control and Prevention guidelines, the cruise ship passengers could not be on the same flight with non-passengers, which is why they were not on the flight which was organized by Travel Edge on Tuesday. Travel Edge and Coral Princess had agreed and received approval for a disembarkation plan that involved taking cruise passengers straight by bus to the ship to the airport, and the cruise line chartered the flights to bring the Bermudians home. With that, I'm now going to turn over the mic to the Minister of National Security, Minister Wayne Keynes, who will give an update on matters under the Ministry of National Security. Minister.
Thank you, Premier. Good evening, Bermuda. The joint operation of the officers of the Bermuda Police Service and the Royal Bermuda Regiment, their work is ongoing. Over the last 24-hour period, 27 community advisory points were executed. There were more than 4,000 stops. We did see a reduction in traffic at night. The Royal Bermuda Regiment soldiers continue to provide support to essential government personnel in a variety of capacities. The Royal Bermuda Regiment and the Bermuda Police Service continue to assist the Department of Health with critical tasks, including the transporting of our healthcare workers via government buses. The Royal Bermuda Regiment have worked with the government shelter team to assist in the relocation at the Cedar Bridge Academy. The Coast Guard were busy on the water over the last 24 hours. They assisted in escorting 2 vessels that entered Bermuda's waters to St. George's for customs clearance. In another incident, the Coast Guard intercepted and turned back a vessel with 4 passengers on board who were heading out for a day of fishing. The vessel did not have a valid fishing license. The BPS has advised that 3 shelter-in-place related arrests were executed for various matters. The Bermuda Police Service served a shelter-in-place summons on 2 persons who were out running early hours in the morning in the Napton Hill area. As I said yesterday, anyone who does not have a legitimate reason for being out on the roads, on the waters for that matter, during the shelter-in-place will either be turned back, detained, or even in some cases, as we've seen, arrested and brought before the courts. Turning to the government-run quarantine facilities. Yesterday, we advised that we were allowing some flexibility so that persons who have family or friends in one of the facilities, they would be able to drop off care packages for them. Today was the first day, and the reports from our team indicates that everything went well, and individuals in these facilities were able to receive key necessities. Essential care package drop-offs will follow the day of the week surname pattern, and drop-offs will continue tomorrow, Friday, April 10th, Tuesday, April 14th, and Friday, April 17th. The drop-off time is from 1 p.m. to 5 p.m. The essential care package should only contain key items such as toiletries, medication, and essential foods, inclusive of any special dietary items. Please note that the essential packages will be screened for contraband. On to kites. Tomorrow and over the weekend, we have a tradition of flying kites. We are asking that you fly the kites in your own yard or garden. If the kite goes outside of your yard and goes down, we're asking you to abandon your kite. Please note that parks, playgrounds, and beaches will all be closed. Thank you.
Thank you very much, Minister of National Security. I will now hand the press conference over to the Attorney General and Minister of Legal Affairs, Ms. Kathy Lynn Simmons, who will update on the government shelter.
Thank you, Premier. Good evening, Bermuda. I would like to provide an update on the arrangements that our government has put in place to help our homeless citizens shelter in place. First, let me say that this has been an extraordinary undertaking to house over 40 adults for a 24-hour period in a facility that is not usually set up for this capacity for this very, very long period of time. Normally, such arrangements are made for a hurricane, but during these unprecedented times, we have adapted and continue to adapt to the challenges faced. Since the shelter-in-place order, the team at the Department of Child and Family Services, with professional assistance from the Department of Health, the Mid-Atlantic Wellness Institute, and St. John's Ambulance, have maintained and managed the shelter at the Berkeley Institute. As of today, we have relocated the shelter to the gym at Cedar Ridge Academy to accommodate the required social distancing practices. Additional space has been provided, and there are additional facilities. The shelter will operate on a 24-hour schedule that includes regular cleaning, maintenance, meals, and bathroom facilities. I repeat, the shelter is now open for 24 hours to meet the needs of our homeless citizens and to provide protection for them during this period. The gym at Cedar Ridge is set up with 40 beds in 2 separate areas for males and females. The Department of Environmental Health has today approved the facility. Let me take this opportunity to thank the Royal Bermuda Regiment for their assistance today in transporting the cots to Cedar Ridge. The ministry will have a minimum of 4 staff at all times that the shelter is open. In order for the facility to operate 24 hours a day, we require medical staff on the premises at all times. Therefore, we are pleased to have the service of mental health nurses from the Mid-Atlantic Wellness Institute available from 6 p.m. to 6 a.m., and this is no change from the services provided at the Berkeley site. There are no addiction service providers at this time, and the public should note that Turning Point is available during the day only. St. John's Ambulance will be on site from 6 p.m. to 6 a.m., and this also is no change from the Berkeley. We do realize that as the health challenges mount, resources such as nurses and doctors will become scarcer. Therefore, we would like persons in the community, particularly doctors and nurses, to volunteer their services if possible. If you're able to do so, the number to contact us on is 707-2223. And finally, in closing, I'd like to thank the Department of Child and Family Services, the Mid-Atlantic Wellness Institute, and the St. John's Ambulance, and all of our third sector and charities that we're working with to meet the needs of our vulnerable citizens.
Thank you, AG. And I would like to echo the thanks of the Attorney General for certainly the work that has gone into place to make this a reality. Given the public health crisis in which we're in, it is quite a particular undertaking to make sure that the facility is safe. And I would like to say that it is a testament to the ethos of the government of Bermuda to make sure that we are not forgetting our most vulnerable during this particular time. I will now turn the press conference over to the Minister of Tourism and Transport, Minister Zane De Silva, to give an update regarding the Transport Control Department. Minister.
Thank you, Premier, and good evening, Bermuda. I'd like to clarify for the public the process by which motorists can relicense their private vehicles, whilst the Transport Control Department, also known as TCD, is closed. The public will recall that TCD introduced the eTCD licensing option 12 years ago. This provided private vehicle owners, that is, owners of private motor cars, motorcycles, and auxiliary bicycles, the convenience of paying their insurance premium, getting their vehicle examined and passed, and instead of lining up at TCD, complete the relicensing process online from the comfort of their office or home. The hard copy of the vehicle registration, which is required to be displayed in the vehicle, is then mailed to the owner. The public is aware that COVID-19 work from home directive is in place, and TCD is currently closed to walk-in customers. Despite this, we have encouraged vehicle owners to make it a priority to ensure their insurance policy is paid and to relicense their vehicles online using the eTCD system, although TCD is unable to mail out a hard copy of their new vehicle registration. While the department closed, there were approximately 250 vehicles that had been examined and passed but were not able to be relicensed. I can report that those vehicle owners are successfully using ETCD to relicense their vehicles. Unfortunately, however, with TCD closed, there remains the issue of how to get vehicles examined in order to complete the relicensing process. Many persons were unable to get their vehicles examined. Without a successful examination, they are now unable to utilize the ETCD system for relicensing. To address this issue, TCD is reprogramming the ETCD system to accept relicense submissions without having completed a successful vehicle examination. This will only apply to private vehicles that have already expired or are due to be relicensed by April 30th, 2020. These classes of vehicles will be permitted to be relicensed for a period of 3 months only. Just to be clear, I will repeat the information. The ETCD system is being programmed to only accept relicense submissions for private vehicles that have either already expired or need to be relicensed by April 30th, 2020. The online relicense is only valid for 3 months. Prior to the end of the 3-month period, the owner must arrange for the vehicle to be examined, and at that point, the vehicle can be licensed for the remaining 9 months of the year. The payments to TCD will be prorated accordingly. The Bermuda Police Service is aware of the inability of owners to display the current vehicle registration in their car. However, the BPS can check that the vehicle owner has up-to-date insurance policy and has relicensed the vehicle for the period that applies. 3 months, if not examined, a full year is already examined. Therefore, vehicle owners are urged to renew their insurance and go online to relicense their vehicle. Compliant owners will not be ticketed for failing to display the new vehicle registration. The reprogramming is being undertaken right now and should be ready tomorrow. So please check etcd.gov.bm. In all of this, it is of most paramount importance and the responsibility of all vehicle owners to make sure that your vehicle is safe to drive. Before driving, you should check that all your lights are working and your brakes are functioning properly. All members of the public, especially those owners of vehicles to be tested, are urged to ensure their vehicles are safe to drive before traveling on the public roads. Thank you.
Thank you, Minister De Silva. Before I close, I'd like to touch on a topic of which I spoke about last week, which is the necessity of us to use this period in time to upgrade our skills. Now is the time to start thinking about the future. While we are observing the shelter-in-place order, many people are at home with extra time on their hands. This is the time to start thinking about the next step. What skills do you have that will help you in the post-COVID economy? The Department of Workforce Development provides support and online training for anyone who is considering a career change or is interested in learning new skills. Persons can complete an online career assessment which measures aptitude and interests. The results can be used to make informed choices about careers and to help with educational planning. If you are interested in completing a Career Scope online assessment, you can send an email to dwd@gov.bm and you'll receive a link and instructions to get started. Workforce Development also offers free online tutorials in the Microsoft Office suite and many more using IBM Connexa Prove-It. IBM Connexa has many online tutorials and assessments which can be tailored to the individual's needs as you look to retool and enhance your skill. And you can use the same email, dwd@gov.bm, for instructions to get started. If you're interested in learning more about FinTech, there are free online courses that are available for Bermudians, and those are available at fintech.bm. I will urge each of you who are hoping to upgrade their skills to take advantage of these online resources which are offered free of charge and give you the opportunity to use this time in a more productive fashion. In closing, I would like to recognize our essential and critical workers. You may have noticed some photographs here at the press conference set this evening. These pictures were taken by Jade Gibbons of Queendom Heights, and there are pictures of those on the front line who are making a difference for Bermuda. Before my press conference started, there was an ad which was produced by the Department of Communications and the wonderful team here at CITV, and you can see them at the close of this press conference as well. And it is a video collage of the images taken by Ms. Gibbons, and it will be available on all of government's social media. As I said yesterday, and as I close, I would like to make sure that we all remember our essential workers who are doing everything they can to ensure that this country is able to operate and we all remain safe. Over the next few days, please take some time to send a message, a nice voice note, or maybe even make a quick phone call or video call to a healthcare professional, because they are the true heroes that are working day and night to keep us safe. In the spirit of this weekend, which is the holiest on the Christian calendar, there will not be any regular press conference on Friday, Saturday, or Sunday, and the next time that I will address you from this place will be on Monday afternoon. The Ministry of Health will be sending out an update on Saturday only. That means that there will be no update on the testing tomorrow, Good Friday, and there will be no update on testing on Easter Sunday. However, we will be back here with you on Monday. I sincerely hope that we take this time this weekend to connect with our family and our friends. And for those persons who follow the Christian faith, I wish you a happy Good Friday and a happy Easter holiday. With that, I'm happy to take any questions that you may have.
Minister, what are the health authorities doing to ensure that cross-infections don't occur between persons staying at the government quarantine facilities, either between returning passengers or between staff manning the quarantine facilities and delivering food and other items to them?
I can tell you that there have been instructions from the Ministry of Health with respect to ensuring that safe distancing is practiced. That may be a question that's more amply suited for Minister of National Security, who has day-to-day contact with respect to those persons that are in the government quarantine facilities. However, they have been issued guidelines concerning social distancing, as well as those other types of practices as it relates to those persons that are in the government quarantine facilities.
Whilst the facilities are not a prison or anything akin to that, we do have security that are in all of our facilities, and we have a manager from the Disaster Risk Reduction and Mitigation Team that is in the facilities, making sure that all the rooms are, that all of the people staying in the quarantine facilities are respecting the social distancing laws. They're even looking at, there were some complaints initially about some of the food in some of the facilities, and we've been rectifying that. We've heard the cries from the parents that said that they were not able to give their kids specific items, and you've seen us manage that as well. And so the facilities are managed, each of them, by a member of the Disaster Risk Reduction and Mitigation Team, and they're not only looking at this for the overall social well-being, they're making sure that social distancing guidelines are being followed, and they're also making sure that the emotional and the physical needs are met in their facility. And if there are any concerns, we can direct those directly to one of the managers in those facilities.
Health Minister, there are reports from around the world about COVID-19 reactivations. The reactivation rate is said in some cases to be between 10 and 14%. What are government's plans to ensure that people who have recovered aren't going to reactivate and then unknowingly infect their families or others while visiting grocery stores, et cetera, once the lockdown passes?
Well, like I've said previously, Don, this deals specifically with the supplies and the level of supplies, and we've spoken about that. and that we are confident that we have the ability to continue our aggressive testing, which may also include persons after they've come out of the 14-day incubation period. But we are continuing our aggressive regime with respect to testing. We're continuing to access other supplies from other regions, et cetera, but we will continue to test, as has been the directive of the Premier.
Minister Keynes, I know this is like a frustrating point for you, people just not listening to the shelter-in-place guidelines. This morning, there were several people out on the beach running between 7 and 9 o'clock this morning. What is trying to be done to hammer home this point to these people that they need to be in their home and not out on the beach?
This afternoon, I was walking along Parliament Street, and I saw two gentlemen on a bike just going for a jolly. They were stopped by officers of the Bermuda Regiment. They were questioned, and shortly thereafter, I could see these men that they're being arrested by members of the Bermuda Police Service. This is something that we're going to do on a regular basis. We don't want to do it, but we will do it to maintain law and order. As the Premier gave us the indication of 9 cases and 4 people dead, my heart was immediately heavy. Those are the costs that we're trying to mitigate. We are trying to save lives with these actions. People being on the beach running early in the morning when they have been told, instructed, the law has put in place that they should not do so. Well, we will now arrest them and they'll be placed before the courts. But outside of that, as a community, we have to look at our actions and breaking the rule, how it would affect everyone else in our community.
Thank you.
Premier, can you disclose there's 9 new cases? Are they persons off of the flight, the latest UK flight, or community transfer?
We do not classify community transmission because we do not have evidence of community transmission. That community transmission, as the Minister of Health has indicated before, when you have a large number of unrelated cases. What we have in Bermuda are clusters of cases of local transmission. The 9 new cases which have come in on the last few days, if I can count correctly.
Do you want me to answer?
Most, sorry?
Do you want me to answer today?
Most of them are under investigation, but the Minister of Health will be able to give further things. Go ahead, Minister.
Yeah, thank you, Premier. Those cases were all identified today, so the contact tracing has begun, as well as contacting the next of kin with respect to those persons. So that is an exercise that literally has just begun because they were identified only a few hours ago.
Thank you. Premier, with the defiance of many people still traveling up and down the island, is there a possibility, we understand that a 21-day full lockdown is on the table, is that, are you discussing that with the Cabinet?
I'm not entirely certain how you could understand that that's on the table if that's not something that has been discussed.
Okay, thank you much. Appreciate that. My next question, with the situation with the Cayman Islands, the UK government confiscating medical supplies, has that happened with medical supplies coming out of America, destined for Bermuda?
Okay, I think when you asked your question, you said the UK government. I think you're
No, I'm sorry, U.S. government.
The
I'm sorry,
US
U.S. government, my bad.
The United States government has issued the President of the United States has issued a directive under the United States Defense Production Act, and they've classified PPE as something that is not able to be exported from any U.S. producers. That is the reason why we are looking to source our PPE from other places. I can say that if there are particular issues in that case, it would not be something of which we'd be willing to discuss, as these are sensitive international matters. However, as the Minister of Health has indicated to questions that are answered to Don Burgess, we do believe that we'll be able to secure not only the PPE, of which is necessary and required for our frontline workers, not only the persons who are out essential services and others, but also in regards to our testing supplies to maintain our aggressive testing regime.
Mr. Keynes, being the first full week of the alphabet shopping conditions, there was a couple of senior citizens in line today at Linda's and Ward. Been in line for three hours. By the time they got to the door, they were told that their date was yesterday, and they were refused. Are there any plans to revisit, and especially with the alphabetical orders A to H, I to Q, R to Z? What my question is that the system that you have in place now, from M to Z, they have more, the population have more of a last name, the Outerbridges, the Simmonses, the Smiths, and the Talkers in that age bracket that fills up the lines. Would it be possible you might revisit that system?
Travel will be met at Cabinet today. We made some recommendations. Hopefully tomorrow evening I can come and share with you our new recommendations. Excuse me, on Monday I can share with you our new recommendations.
Trevor, just as a clarifying point, as the Minister of Health and I are busy trying to review these things, you'd asked about the 9 new cases.
Yes, sir.
Out of the 9 new cases, 4 of them are classified as limited local transmission or local transmission. 5 of them are under investigation, and out of the 9 new cases, 5 of those 9 new cases are hospitalized.
Limited local transmission. Can you break that down? 'Cause
Limited
is that
local
not-
transmission, as we said before, would be at either the workplace or at home.
Good afternoon, Mr. Premier. Good afternoon, ministers. Regarding the new cases, we understand that one of the
Can't hear
new
you.
patients.
Can't hear you.
Very sorry. We at the Royal Gazette understand that one of the new patients may have been a resident at one of the island's rest homes. Can you confirm that? And can you say either way what measures are being taken to prevent spread of this at rest homes where obviously seniors are quite likely to be seriously harmed by this virus?
Yes, I can answer that in 2 ways. First, with respect to the first part of your question, as I indicated to Trevor, many of those persons, we've just received the test results a few hours ago, so it would be totally inappropriate for me to comment further as to providing any information that might or might not identify those persons. Because again, the physicians have, the process is once the test results come back, then the physician is notified and the physician notifies the patient. So it's still very, very early. The results only came back a couple hours ago. But under the Public Health Emergency Response Team and under the Incident Command, one of the sections of that particular command center deals specifically with rest homes and our nursing home facilities. And the person that leads that is Rashina Masters, and they have spent quite a number of time between herself as well as other members of the team in Aging and Disability Services going to the rest homes to provide them with guidance. In fact, if you look at the website of the Ministry of Health, we have specific guidelines for persons that occupy rest homes so that they can ensure that they do social distancing, ensuring that the proper cleaning measures and sanitation measures are also applied. So all of that is underway. In fact, it's been several weeks when the guidance when the guidance first came out, and one of the first requirements was to stop visitation except for end of life, so that we could, even before we did this actual emergency shelter in place order. So there are a number of regulations outlined in the guidance. So we have been working with rest homes because we appreciate that that is our most vulnerable population, and worldwide those are the persons that are most susceptible to COVID-19. So we have engaged with the Public Health Emergency Response Team has been engaging with them on a regular basis for several weeks now.
Okay. Now, Mrs. Wilson, right now we have an issue where we have 48 people who have been tested positive for this virus, and 4 people on the island who passed away. That is 1 in 12 mortality rate. That seems very high. Can you say what is causing that high rate? Is it a case of our citizens being particularly vulnerable, or is it a case of there being asymptomatic individuals in the community who have not been tested yet?
Actually, we are, like I said yesterday, we are actually doing modeling, and we're making it in the local context. The modeling is based on Public Health England as well as Imperial College in London, and they are assisting with the modeling, and we'll publish that once we've had it finalized with respect to the inputs concerning Bermuda. Of course, that's the projections. And as you can appreciate, unfortunately, we do have a population that is unhealthy, and there's quite a number of non-communicable chronic diseases within our population, and that makes those persons even more susceptible to the respiratory challenges that come with persons that test positive for COVID-19.
Now, the issue of testing kits has come up quite a lot at these press conferences. The Cayman Compass is reporting that the Cayman government has agreed to provide 35,000 kits to Bermuda. Can you confirm this is the case?
What I can say is that from a testing perspective, you would remember last week I reported that Dr. Karika Weldon had secured 40,000, the capacity to do 40,000 tests here in Bermuda, and that was provided by a private donor who had purchased those particular test kits. The first portion of those arrived on the British Airways flight, and we're going to expect additional items that are coming. We do know that we have the testing capacity on island right now to test as much as we need and to ramp up our testing regime, and it's my expectation that you'll see these numbers of the persons of whom we test will increase on a rapid basis. Yesterday, the Premier of the Cayman Islands did give me a call, spoke about the fact, because as I said, us overseas territories leaders are in regular points in contact, and the fact is that between himself, myself, the Premier of the Turks and Caicos, the Premier of the British Virgin Islands, we actually, as I said, have a WhatsApp group, and we keep in constant contact and communications of the challenges of which we're individually facing, the strategies of which we're using inside of our individual jurisdictions, et cetera. So as we are all looking to procure certain items, there isn't a need for all of us to keep working on procuring the same items. So from that conversation yesterday, there are some items that we've procured which may be in excess of which we're looking to have, and there are some items of which there are shortages of. So the fact that the Cayman Islands has 165,000 tests on their shores, and the fact that which we have a number of tests on our shores, there are other limiting factors for these things. And limiting factors are the number of swabs, viral transport media, etc. So I think you would realize inside of that article from the Cayman Compass, of which I've just read while I'm sitting here at this desk, the conversation with the Premier of the Cayman Islands and myself was the fact that there are certain things that we have which we may be able to supply, because one of the things of which we had a discussion as part of our conversation yesterday was with the issue of the swabs, which are required to take tests, which there are a global shortage of those particular issues. But these are things of which we're in regular communication with, and this is the reason why I don't want us to focus on, I would say, the overall testing number, the overall testing kits of which you have. The fact is that here in Bermuda right now, in addition to the facility of Dr. Spriggs, the additional machines which were donated by Roche, which were here, we have 2 additional PCR machines, in addition to other machines which are here on island, which are running validation tests in the Bermuda hospital and ran validation tests last night. We are perfectly capable and confident that we'll be able to have an aggressive testing regime here in Bermuda. So a lot of people want to focus on the volume. Premier McLaughlin said that he bought all those tests. He knew that he would not need all those tests, but that was the minimum order of which he could provide, and we were happy to share inside of that particular load.
Now, as this situation continues, eventually the House of Assembly and the Senate will have to meet again. Is there any debate about having remote meetings of the Houses of Legislature?
There is certainly debate and discussion around that. That was something in which we wanted to have set up for Monday's sitting. We were not able to get it done in time. But if the situation does continue, if the situation does worsen, then we'll be looking at all particular eventualities. But I just want to be clear to everyone. I do not want this situation to continue indefinitely. That is not our intention, and that is the reason why it is important that persons stay where they are to minimize the chance of possible transmission of this virus, to make sure that they are wearing face coverings when they are in public, and to abide by the rules and regulations. We are going to be spending our time, the Cabinet met earlier today, the Cabinet will meet again on Tuesday, and speak about what it's going to take and require the rules and regulations in order to get our country and our economy back to a semblance of functionality. This is not the ideal position that us or any leader wants to find ourselves in, but this is where we are at this point in time here in Bermuda. So the most important thing, I would say, for all of us to do is to ensure that we are observing our the requirements of which have been set out. To go back to a question which you asked earlier, with 4 deaths, and if you look at the global rate, then that would imply that there's a larger number of cases which we may not have captured or caught yet. And that's why it's important, as we implement more aggressive testing, that people stay in place. I cannot express it enough. If you decide to go to the grocery store for your social outing, recognize you may be putting your family at risk. It's that simple.
Thank you very much.
I have another few questions. Are all those that are in quarantine, are they being tested? Minister Powell?
Sorry, are those persons in quarantine being tested?
They're all being tested, yes.
Not at this point in time. The fact is that that's not something that is thought of required right now.
No, why not?
Why not?
Yeah.
The fact is that you don't spend testing. As I said, every country has a limited amount of testing supplies. Understand this. So you can have a number of test kits, but there's a limited number of testing supplies. At this point in time, it is most important. Those are persons who are on 14-day self-quarantine who can't leave their rooms. Those aren't the persons. You want to look at healthcare workers, those persons of contacts who may have been exposed, so you can break the chains of transmission. People who are inside of a government-run quarantine facility who aren't going anywhere, eventually they may be tested, but they're not the priority right now. It's likely that they might be tested before they leave, though.
Okay. Minister, however, you did say that you're waiting for supplies to come from China, correct?
Yes.
Didn't this virus start in China? Do you really trust the Chinese government? That's a question that was asked, that was sent to me to ask.
Sure.
I'm asking the question.
Sure, thank you. There are quite a number of suppliers of the medical equipment and the PPEs that all have been vetted and recognized and recognizing and adhering to best practice and international standards, and those companies happen to have their manufacturing plants in China. So I appreciate your question. China's a very vast country. I'm sure probably almost everything that we're wearing in here is probably made in China. But the reality is that through the vetting and the procurement process, we're ensuring that whatever items are procured from China are compliant with international standards to make sure that we are getting the best practice in what we're getting.
Are all the nursing homes have PPE equipment? The nursing homes, do they have adequate PPE equipment?
Again, as I indicated with Owen, there is one of the arms of the public health emergency response team deals specifically with the nursing homes, and many of them do have their requisite supply of PPEs for their nursing staff. Some of them are short. However, the ultimate supplies of not only the hospital as well as the needs for the health department, regiment, et cetera, the community are all at Southside, so that's being dispersed based on need. So any nursing home we're in contact with, and if any of them have requirements with respect to shortages of PPEs or hand sanitizers or the like, that is being provided to those nursing homes, yes.
There is a great need for masks, and we talked about it for the last few days. There are some seamsters that are making masks at home. The hospital, I saw something on social media, the hospital put out 1,500 masks. Is there an avenue for those that are making those masks at home? Can they bring on an extra person to assist in this backlog of masks that are being required?
Trevor, this is something that was discussed at our cabinet meeting earlier today. As I have mentioned previously, the mask initiative is being led by Colonel Birch, the Minister of Public Works. The persons who are manufacturing masks are being provided with additional supplies, additional materials in order to make sure that those masks can continue to be made for individuals on a case-by-case basis, which are looking to do that. We're handling that on a case-by-case basis, so we're not issuing blanket exemptions. What we want people to do is to stay home. It defeats the purpose of having two persons inside of from two separate households inside of the same space where they might be able to possibly transmit the virus, and that is the purpose of what we are trying to do right now. So the fact is that there are persons that are wearing masks. The persons have been in contact with the Ministry of Public Works. If there's more persons that are wearing masks, they're welcome. There are more persons who are making masks. They are welcome to get in contact, and we are continuing that particular process of making sure that we are ramping up the ability of masks to be made at home so that persons can make sure that they can have access to those particular masks. And the Ministry of Public Works is also working with the grocery stores and others to get those masks from those individuals to make them available for sale at those particular points. But right now, it is not envisioned that we're giving persons permission to leave their homes, to go and deliver masks, to do all the rest. The fact is that we had a very spirited discussion at our cabinet meeting earlier. And there were questions about all forms of possible exemptions of which have been asked for, whether it be from pet stores to other particular items. And the position of the government of Bermuda and the cabinet of Bermuda is that we are not going to be allowing these exemptions because we have this for a particular purpose, and that is for people to stay inside. So the Minister of National Security indicated that following the Attorney General's Chambers finishing drafting, there may be some minor updates to the particular guidance and regulations which have been put out. But there have been requests for a lot of things, and they are not going to be given and or added to these particular requirements. I cannot express how delicate of a situation we are currently in right now. And it is important for everyone. If you care about your neighbors, if you care about your extended family, you will stay home.
With the people that were infected at their workplaces, do the other people at the workplace get notified, and do they get tested?
When a person is tested positive for COVID-19, the epidemiology and surveillance unit starts a process that they refer to as contact tracing. And what that entails is they first will ask whether or not the person that tested positive, who do they live with, who are their immediate family or their housemates or whomever lives in the immediate property. That's the beginning stage of the contact tracing. Then they go and it spreads out. Then they start to ask about those persons that they work with. And if the persons have constant contact with, let's say, 5 people, then they will go and interview those 5 people. And those 5 people, depending on a number of things, it may be they may have not had any interaction with those persons, but the epidemiology and surveillance, it is a science. And part of that science involves asking questions and investigating. And part of that investigation would include questioning those persons who may have had contact with that person that is test positive. In the first instance, they would be asked to quarantine, and in the second instance, if they become symptomatic, then they will be isolated and a test will take place.
Okay, thank you. Also, when asking about, it's a matter of testing policies and dealing with the number of all the supplies for the testing kits. For somebody who's tested positive, could a policy be put into place where a person has to do 2 14-day isolation periods rather than the 14 before being released?
Well, as we've spoken about previously, when a person tests positive, then they are put on isolation, and the isolation period can be either, the period in which they are then technically released, as you spoke about, is either 14 days or 72 hours after the symptoms have abated without any type of pain reliever, whichever period is the longest. So it could very well be 14 days. Whether or not there's consideration of extending that to another 14 days, that would be a recommendation of the chief medical officer, and at this point the evidence doesn't support the need for 28 days because the virus generally lives within you for the 14 days. But that would certainly be something that the epidemiology team, under the direction of the chief medical officer, would consider. That's within their bailiwick and their remit, and it would be based on international best practice.
All right, thank you.
But Dawn, just so I can add to that, because I think it's the question that you ask every time and every day. The fact is that all countries, whether they have 165,000 testing kits or 75,000 testing kits, are dealing with the shortage of the entire testing mantra. As we are able to get more and more supplies, and as we're able to bring additional testing things online, questions such as retesting people and testing people multiple times will certainly be part of the consideration of what it is that we're doing. But the most important thing to do right now, and the reason why everyone is actually sheltered in place, is for us to identify the chains of transmission of which currently exist for our confirmed cases, to get those persons tested and isolated, and to ensure that we do not have multiple chains of transmission that are going throughout the country.
Thank you. One last for Mr. Keynes. Mr. Keynes, I understand that management at Westgate have given inmates a template, and there are a few inmates at Westgate that know how to sew and are considered male seamstress. Are there any way of giving these guys a little play in producing masks?
Thank you for that, Trevor. We have given the template to the inmates at Westgate. the sewing teacher is spending time with them and they are making masks. We would like to see if there is a possibility for us to scale up, and if it is a possibility, the men at the Westgate Correctional Facilities are anxious to be a part of the effort to help our country, and we will put them to work and use their masks if we're indeed able to scale it up. And we've looked at all of the legal parameters around it, and it is consistent, and we are able to do so. We would love to get them involved in the effort.
Good stuff.
Anything else? All right. Well, everyone, happy Good Friday. Happy Easter. Enjoy your weekend. Stay at home, and we will see you again here on Monday.